I'm May. I'm one of the breast care nurses working at Manchester Foundation Trust. I've been a breast care nurse for a year and I've worked in breast care for 14 years. So when a patient first gets their cancer diagnosis, as you can imagine, they experience lots of feelings of shock, fear. It's hearing that word which brings about a lot of fears, a lot of anxieties about their future and what it holds. So we're there to support them, to listen to them, to listen to any concerns at that point, and be a listener, really. That's what we're there for, because there's lots of things going through their mind. Yes, at that point we do give them some information regarding the diagnosis, and the consultant, the doctor who does see them, will also have explained, what that treatment will involve, whether it be neoadjuvant treatment, chemotherapy, or it be surgery. That will also be discussed at that point if it's relevant. Regarding having a wire inserted makes the day very long because they have to be here very early, having several procedures done even prior to having the surgery. So, again, adding more anxiety to the patient, especially on one day. Having to have the wire put in, then they're requiring an injection to inform the surgeon where the nodes are, then they're going to the ward. So there's a lot of processes prior to actually having the operation, which again brings about a lot of anxiety and fear, and especially fear of the unknown, because they don't know what to expect, even though as breast care nurses we can inform them, and we're there to support them. But again, it does increase anxiety. So having the wire exposed, patients have said, I'm worried about the wire being dislodged, and especially if they're waiting all day, they're worried that something can happen if they get knocked, or even just sitting there, they don't want to do anything because they're worried about that. So it's constantly on the mind throughout the day, wanting to have the wire removed and worried that, something can happen. So I'd say we've been using Magseed for around about 12 months or just under. And regarding the Magseed, it's made such a massive difference to patients. We have the Magseed inserted on a different day prior to surgery, and on that day we involve the pre-op assessment as well. So, patients sort of treatments are done or prior to surgery rather than having to have it all done on one day, which, lightens a load for them having to come in so early in the morning, and also having lots of processes done prior to actually having the surgery, and also for the unit as well, there's not as much pressure on because we know they've had the magnetic seed put in prior to the surgery, so there's not much of a rush to get patients through here at the Nightingale Centre and through to the ward promptly, so things aren't delayed. No one likes to have needles, no one likes to have injections, but I feel patients, especially who have anxiety of needle phobias, knowing that they're not going to have a wire coming out of the breast, I think will make a big difference to everyone, but especially those patients, patients who have had needle phobias and know there's awareness of something there, really, really causes worry to them and high anxiety, that it can actually put people off from having the surgery due to knowing that they need to have that done. So I think this can sort of reduce that anxiety. Yes, it's going to involve needles, but I think knowing that they're not going to be aware of it, I think will make a massive difference to the patients and make their journey easier.